Introduction neck pain is one of the most common forms of disability, accounting for 34% of individuals, according to the literature. Women are seen to be more prone to neck pain than men. A prolonged period of neck pain categorized it as a chronic pain, and the literature also suggests that such type of pain has an exponential increase over years. Despite the various assessments made in the previous studies, MRI-based grading system for cervical canal stenosis and cervical foraminal stenosis with corresponding clinical correlation studies are few in number. Moreover, there are no universally used grading systems. Standardized grading systems would be useful in the improvement of communication between radiologists and clinicians. Our study would be beneficial in gauging the clinical value of MRI-based grading system by correlating them with the standardized clinical assessment tools. Our aims are to evaluate the MRI-based Kang grading system for cervical spinal canal stenosis and correlate with the Japanese Orthopedic Association score, to evaluate the MRI-based PARC grading system for cervical foramen stenosis, and correlate with the neck disability index. Inclusion criteria: all the patients above 18 years undergoing MRI C-spine presenting with one or the more of the following neck pain, radiating pain, neck stiffness, tingling, numbness, weakness, loss of coordination. Exclusion criteria: the patients with cervical spine fractures, spinal cord lesions, post-op patients, patients with surgical implants, patients with bone lesions, patients with cardiac pacemakers, and claustrophobic patients. The study will be performed using a 1.5 Tesla 18-channel MR scanner. In addition to the routine T2-weighted sagittal C-spine sequences, additional T2-weighted oblique sagittal sequences will be performed to assess the cervical neural foramen. The study is an analytical observational study. Once a patient is satisfied the inclusion criteria mentioned above, he or she would undergo MRI for C-spine evaluation after giving consent. Using the mentioned formula, sample size of 35 subjects will be taken. This is the schematic diagram of MRI-based Kang grading system of cervical canal stenosis. Grade 0 is subarachnoid space obliteration less than or equal to 50%. Grade 1 is subarachnoid space obliteration more than 50%. Grade 2 is spinal cord deformity or compression, and grade 3 is spinal cord signal changes. This is the Japanese Orthopedic Association score, which will be correlated with the Kang grading system. A total score of 17 will be given, and it is divided into mild, moderate, and severe based on the score. This is the schematic diagram of the MRI-based PARC grading system for cervical neural foramen stenosis. Grade 0 is no significant stenosis or no perineural fat obliteration. Grade 1 is mild perineural fat obliteration. Grade 2 is moderate perineural fat obliteration without morphological changes of nerve roots. And grade 3 is a severe perineural fat obliteration with collapsed nerve root and morphological changes. This is the neck disability index, which has a total score of 50, and it is divided into no disability, mild, moderate, severe, complete disability based on the score. Coming to the results, most of the patients are female, like accounting for 60%, and 40% of them were male. Age distribution: most of the patients were falling under the age group of 41 to 50, followed by 51 to 60 years age. Most of the patients have two disc levels involved, followed by single disc and three disc levels. At the C2, C3 level, based on the Kang and PARC grading system, most of the patient did not have any spinal canal stenosis or neural foramen narrowing. At the C3, C4 level, most of the patient did not have any spinal canal stenosis or neural foramen narrowing. At C4, C5 level, most of the patient did not have spinal canal stenosis, neural foramen narrowing, followed by grade 1 spinal canal stenosis and neural foramen narrowing. At C5, C6 levels, most of the patients had grade 1 spinal canal stenosis and neural foramen narrowing, followed by grade 2 spinal canal stenosis and neural foramen narrowing. At C6, C7 levels, most of the patients had grade 1 spinal canal stenosis and neural foramen narrowing, followed by grade 2 spinal canal stenosis and neural foramen narrowing. When this MRI-based grading systems are correlated with the clinical systems, 34 patients have correlation with the neck disability index, and 33 patients out of 35 had a correlation with the Japanese Orthopedic Association score. These are few of the cases. This patient had a severe spinal canal stenosis at C6, C7 levels and a severe neural foramen narrowing, and which were correlated with the clinical grading systems. Case 2 had a moderate spinal canal stenosis and moderate neural foramen narrowings. These are also correlated with the clinical grading systems. This patient had a mild neural foramen, spinal canal stenosis and neural foramen narrowing, which are also correlated with the clinical grading systems. Coming to the discussion, the study by Park for clinical correlation with respect to foramen stenosis and clinical correlation with respect to canal stenosis found 52 men and 48% women, which was found to be substantially same to our study. Another study carried out by Park et al. For clinical correlation with respect to canal stenosis found foraminal stenosis recorded the mean age of the study subjects to be 50 years and 46 years respectively, which is substantially close to our studies. On distribution of subjects as per the number of affected disc levels, the maximum number of patients were found to have one disc level affected, followed by 3 disc levels. Lower intercervical vertebrae are found to be more severely affected in comparison to the observed in upper cervical vertebra for neural foramen, with the same changes observed with the canal but with lesser changes or mild in form. Patients with grade 0 cervical canal stenosis showed no neurological manifestations, whereas patients with grade 2 and 3 stenosis showed positive neurological manifestations. Further, clinical grading against a radiological assessment of cervical foramen stenosis with clinical grading systems showed a significant positive correlation was found. Hence, the radiological grading system is reproducible and an easy way to objectively evaluate cervical canal and neural foramen stenosis.